The purpose of this podcast is to provide you with some basic introductory information pertaining to therapeutic equipment prior to coming into lab, where you will have hands-on opportunity with all of the equipment. By the time you're done with this podcast, you should understand how to name the various pieces of therapeutic equipment, and you should also understand the physical properties that each type of equipment has to offer. And that will start to guide your decision-making process when you think about selecting equipment to use with your patients. You will also begin to start building a repertoire of all of the different ways that you can use therapeutic equipment and for what purpose. Please understand that this is an introduction and that there are many, many different applications for use of the equipment that you'll see in this podcast that are not mentioned. One of the main reasons for selecting any piece of therapeutic equipment is that the therapist thinks it's going to add value to the session in some way. You may use therapeutic equipment to assist in addressing patients' impairments such as tone, range of motion, strength. You may choose equipment to work on balance and postural control. Some equipment may be motivating to some patients and you think it's going to add value for that reason. You can make an activity harder or easier by use of therapeutic equipment. So the overall selection process begins with determining what value you think adding the therapeutic equipment or pieces of equipment will have. There are numerous factors which will guide your clinical decision-making process when selecting therapeutic equipment. You need to have a good understanding of what your patient's physical capabilities are from a motor control perspective. What is their strength? What is their range? What is their balance and postural control? So you have to have a really nice picture of what your patient's presentation is. Another factor of consideration would be your comfort level as the physical therapist in use of the therapeutic equipment and your confidence in being able to maintain your patient's safety when using the equipment. You will start to get some hands-on experience with this in the lab in terms of handling patients, safely getting them on and off equipment, and you'll be provided with instruction pertaining to that. But you need to develop skill and comfort in use of the equipment before you can think about then putting your patient on a piece of equipment or using a piece of equipment in any capacity. Other pieces you need to consider: what equipment do you have available to you, and the size and the area that you have to work in. So depending on others that are in the clinic or the space of your treatment area may dictate what you're capable of doing with the equipment and therefore which equipment you select. For example, if you plan to work on rolling with use of a large therapy ball, you're going to need a decent amount of space to be able to accomplish that, as the ball will continue to move throughout that process. Much of the therapeutic equipment that we'll talk about and that you'll go on to use in lab and then in treatment will have a variety of sizes. So you also have to consider which size piece of equipment are you going to use, and that goes back to the purpose of why you're using the equipment. You may want a piece of equipment that really supports your patient or one that challenges them to maintain their own balance with less support. You may pick equipment based on your size and your morphology to your patient's size. Perhaps it's promoting safe body mechanics for you to use a piece of therapeutic equipment while the patient is. So there are lots of reasons that pertain to not only the patient size and how much support you want them to have, but also what is the relationship between the therapist size and the patient size. Therapeutic equipment can be categorized into two main domains, either mobile therapeutic equipment or non-mobile pieces of equipment. So if we're talking about a mobile surface or a mobile piece of equipment, this is an equipment that has some sort of degrees of freedom, and we'll talk about that further in subsequent slides. A non-mobile surface is something that's fairly stationary. So once you've adjusted it to the height or the size that you're looking to use, it's a relatively stationary piece of equipment. We're going to talk about mobile pieces of therapeutic equipment pertaining to the degrees of freedom in which that equipment affords you and the patient. The larger the degrees of freedom, or the higher the degrees, that would mean that that surface has a greater mobility, but then would offer you less stability. The pictures on the slide shows a variety of ways in which you might choose to use a physio ball during a session. It is certainly not an all-inclusive list, and we'll challenge you during lab to think of all of the different ways in which you could incorporate use of physio balls into your sessions. Physio balls have 360 degrees of freedom, so it's our most mobile surface that we can pick, and therefore our least stable. We have a variety of different size physio balls in the lab, and what size you pick is dependent upon the size of your patient and the task or that specific intervention strategy that you want to use the piece of equipment for. The pictures on the slide shows a variety of ways in which you might choose to use a physio ball during a session. It is certainly not an all-inclusive list, and we'll challenge you during lab to think of all of the different ways in which you could incorporate use of physio balls into your sessions. Another factor to consider in selection of physio balls would be the level to which that ball is inflated. A more inflated, or a ball that's firmer, will be easier for the physical therapist to control because it will be a more predictable movement. But that ball will be more challenging for the patient because they'll likely have a smaller base of support with a firmer ball. The converse of that would then also be true. If the ball is underinflated or less inflated, it's a bit more challenging for the physical therapist to control because the movement's unpredictable. But it might be easier for the patient as they might sink down a bit more into that surface and therefore have a larger base of support. The pictures on the slide shows a variety of ways in which you might choose to use a physio ball during a session. It is certainly not an all-inclusive list, and we'll challenge you during lab to think of all of the different ways in which you could incorporate use of physio balls into your sessions. A peanut has less degrees of freedom than a physio ball, but is still a pretty mobile piece of therapeutic equipment. You can see in the pictures below some of the use of a peanut that you might do during therapy. You might choose to have a child sitting on a peanut, either straddling or sitting in another orientation. Children can be positioned in prone on a peanut, in quadruped, thinking about working stability of different muscle groups. You may have a child standing at a peanut to promote some weight bearing, but yet still gives you some external support. So there are a lot of different indications and applications for use of the peanut. The size of the peanut that you would pick would be dictated based on all of the factors we've already discussed: your patient size, the task in which you're working on, and how you envision using the peanut in your session. Bolsters are still mobile pieces of therapeutic equipment, but they do have less degrees of freedom when compared to the peanuts and the physio balls. Bolsters come in a variety of different sizes that are based on their diameter. Bolsters can be made out of a dense foam, which is the majority of what we have in lab, but they can also be made out of styrofoam. You would pick a bolster depending on the task in which you wanted to do and the size of your patient, and then select an appropriate diameter bolster. It's important to note that if you're using a bolster for sitting, that you want to make sure that your patient has appropriate and adequate amount of weight bearing so that they're actually sitting on their IT. So you want to pick a bolster that's large enough to afford the patient this opportunity, but not too large that it's overstretching them or putting them in poor alignment. Bolsters can be used in a variety of ways, some of which are shown in the pictures below. You could use a bolster for sitting. You could use a bolster for transitioning, perhaps from side sit to quadruped. You could use bolsters to help maintain positions while in quadruped. Perhaps you have the bolster standing up and you're using it to work on single and balance for a standing activity. Perhaps the child's trying to kick the bolster over. Maybe you want to work on heavy sorts of work and input, so you have the child carrying the bolster from one part of the room to another. There are many different applications in use of bolsters, which we will challenge you to think about and use during lab. Tilt boards also offer mobility to the patient, but they do have less degrees of freedom as compared to the bolsters and the peanuts and the balls. They allow for either anterior to posterior movement or medial to lateral movement. They come in a variety of sizes, and you can think about using tilt boards for a variety of reasons. You could work on developmental positions through use of a tilt board, and you could have either the patient's upper extremity supported or both their upper and lower extremities supported. So you'll see a variety of ways in which you could use tilt boards. You could use tilt boards together, couple them together for activities, or use with other pieces of therapeutic equipment. Inflatable wedges and discs also do offer some mobility for the patient, but have less degrees of freedom than the other pieces of equipment that we've talked about so far. You can use inflatable wedges and discs in a variety of ways. You may choose to use them for their somatosensory qualities when you think about hand prep or foot prep. You may offer it to a patient to provide a more dynamic base of support, such as this little girl here in the picture is doing in sitting. So many different ways in which you can incorporate those into treatment. Scooter boards offer mobility to the patient in terms of vestibular input, so you can think about that as either a linear or angular acceleration. Your patient could be in prone on the scooter board, they could be in sitting on the scooter board, and depending on your patient and the way you've decided to use the scooter board, you could address pieces such as core stability, symmetrical use of upper extremities, looking to add vestibular input into that activity. So many different applications for use of scooter board. It's important to note that when you are done using a scooter board, that you either need to stand it up against a surface or you want to flip it so that the wheels are up. It's really dangerous to leave the scooter board down, as we might use it for an actual activity because it does have such mobility. Next, we'll move into discussion of non-mobile pieces of therapeutic equipment, and we'll start by talking about benches. We have many different size benches in our lab, and a lot of our benches are adjustable. You could change the overall height of the bench, you could change the angle of the bench, or even the symmetry of the bench from left to right. Oftentimes we choose a 90-90 position for our patients in sitting on a bench. So their feet are always supported on the support surface. And then most of the time we select a 90-90 position in that the hips are at 90 degrees in relation to the trunk, and the knees are also at 90 degrees in relation to the femur and the floor. But there are times and indications for why we might deviate from that position. For example, you might choose to have the patient in a more open hip angle, and this would be when the amount of hip flexion is greater than 90 if you're measuring in relation from the trunk and then the midline of the femur. In this position, the patient may have more of an anterior pelvic tilt, which might then promote a more upright trunk position or spinal extension. And then the converse of that would be true. You may choose to have your patient in more of a closed hip angle, where the hip flexion in relation to the trunk is less than 90, and this might promote a more flexed posture when looking at the trunk. An indication for this closed hip angle might be if your child had a lot of extension tone and they were extending off the surface, you may choose to close the hip angle, which would thereby promote flexion. As with any piece of equipment, there are many ways in which you can use the equipment other than just the standard way of using them to sit on. You could use equipment to support a developmental position, such as tall kneeling. You may use benches of varying heights to promote creeping, and we have a set of nesting benches in the lab that are made out of wood that you could use those for. You may have a child in standing and their foot is on a lower stool or bench to promote single and balance. You may use benches as part of an obstacle course and where a child has to climb over or creep under. So there are many different applications for use of benches. You may use stationary wedges throughout your intervention for a variety of reasons. Wedges could be made out of different materials such as the dense foam, very similar to what the bolsters are made out of, or it could be more of a compliant surface such as what you see in the picture below with the little boy who's walking up. You could use wedges for positioning, so you could think about positioning the child in prone so that it's a bit easier for them to work against gravity because you've accepted some of their weight for them. Wedges could encourage mobility, so even though it's a stationary piece of equipment, you could think about making rolling a bit easier if you're going down the wedge, or a bit more challenging if you're going up and you're trying to work on core strengthening. Children can use wedges for combat crawling or creeping or walking. They could be used to reduce the effects of gravity, as in some of the examples already provided, or if you consider just a simple exercise as coming to sit up or sitting up, if the child was using a wedge to complete that in essence would be easier than coming up from a flat surface. So many different applications for use of wedges. Lastly, we'll talk about non-mobile therapeutic equipment such as chairs and mat tables and plinths. Chairs in the lab and in typical clinics, you may have the opportunity to use a chair with arms or without arms, and that decision would be based on the balance and postural control of your patient and the task in which you would like to use the chair for. We also have mat tables and plinths that are adjustable in height, and then those that are stationary. You may use that equipment in a variety of capacities, from having a large surface area to work on something such as rolling or transitioning. You may use that equipment as a surface for transitioning from the floor to stand, or for a child who's working on cruising. So many different applications for these types of non-mobile pieces of equipment. Now that you have this foundational piece on the types of equipment and the properties that they offer you, you're going to take this information into lab and you're going to see faculty-led demonstrations on the different pieces of equipment. Then you're going to get experience in hands-on psychomotor practice in different stations to expose you to using both mobile and non-mobile pieces of therapeutic equipment. And then lastly, to put these pieces together when we think about then going to treat, you'll have the opportunity to identify patient problems from an impairment perspective and come up with very short demonstrations of ideas on how you would use specific therapeutic equipment to address a given impairment for a patient.